The medical field is a place of miraculous innovation and multidisciplinary excellence, in large part due to both the rich scientific basis for modern medicine and the breadth of subfields and specializations. However, despite the richness of the field, the American medical sector is known to suffer blind spots both in accessibility and in the breadth of acknowledged care strategies. Nearly every family has at least one experience with an illness or ailment that stumped doctors and resisted standard treatments, leaving only unanswered questions and discomfort. These are the kinds of problems that new specializations of medicine seek to solve by developing novel treatments for difficult illnesses, and it's also why Dr. David Borenstein, MD, founded Manhattan Integrative Medicine. Board certified by the American College for Advancement in Medicine, the American Academy of Anti-Aging Medicine, and other medical associations, Dr. Borenstein blends traditional and holistic medicine to deliver the best outcomes for patients. As South Florida's leading integrative and functional medicine physician, Dr. Borenstein has built his career around the belief that his job isn't merely to manage patients' symptoms, but to help them rebuild their health and experience total wellness. Just as the human body is a wholly interconnected system, Dr. David Borenstein's expertise and areas of specialization do not exist in isolation. Whether it's his certification in physical medicine and rehabilitation, or in medical acupuncture, or his work as chief investigator researching spinal cord injuries, all of Dr. Borenstein's experience is aimed at one goal: improving patient outcomes. I found that traditional medicine alone falls short in the treatment of many chronic conditions, Dr. Borenstein says. After seeing a patient with fibromyalgia not improve with traditional treatment, I went on a journey to see what else was out there. This led me to the field of integrative and functional medicine. The field of functional and integrative medicine differs from traditional medicine in its framework as much as in its actual treatments. Much of modern medicine is devoted to managing symptoms and working backwards toward cures and treatments, which works often but not all of the time. Functional and integrative medicine approaches each problem from the perspective of the whole body, focusing on the root causes of chronic illness and heavily emphasizing diet, lifestyle, and stress reduction. Put simply, it's a more proactive approach to medicine. Functional medicine practitioners utilize a variety of diagnostic tools, including detailed patient histories, comprehensive lab testing that goes beyond traditional panels, and functional assessments, to create a personalized treatment plan, explains Dr. Borenstein. We emphasize identifying the underlying imbalances or disruptions within the body that contribute to illness. Functional medicine is most applicable in the treatment of chronic diseases. Chronic fatigue, fibromyalgia, irritable bowel syndrome, PCOS, hypothyroidism, Hashimoto's. Illnesses like these are what the field of functional and integrative medicine formed to address. In practice, the field merges modern, evidence-based medicine with time-tested and researched holistic healing practices to create new, out-of-the-box treatment plans. One of the primary misconceptions Dr. Borenstein has seen get between patients and effective care is one regarding the scientific basis for functional and integrative medicine. Because the field blends traditional and holistic healthcare approaches, some may assume that practitioners reject conventional treatments and modern medicine. This is far from the case. Functional medicine works alongside traditional care, as it leverages pharmaceuticals, surgeries, and advanced imaging technologies wherever necessary, but puts a focus on root cause resolution. Medication is one of many tools, but is not treated as the only solution. Another draw toward functional medicine is social as much as it is medical. Patients with chronic illness often suffer experiences where traditional doctors dismiss or minimize their symptoms, or simply lack the training to guide them toward other potential solutions. Women in particular have adverse interactions with medical professionals at a higher rate than average, with the outcome often being symptoms like pain or nausea being downplayed or misdiagnosed. A new medical paradigm must account for and resolve experiences like these to succeed, and the field of functional medicine aims to do just that. The demand for functional medicine is surging as patients seek personalized, root cause resolution for chronic issues, Dr. David Borenstein says. We listen, we don't dismiss, and we work hard with the patient to address their issues. More and more patients are going outside their network to experience this personalized, patient-centered approach to healthcare, Dr. Borenstein has found that, in many cases, effective treatments start with targeted changes to the patient's lifestyle. Dietary changes to address nutritional deficiencies and promote gut health go a long way, even for illnesses like depression. For example, instead of immediately leaping to an antidepressant drug, The integrative medicine approach would start by identifying deficiencies in vitamin D, magnesium, zinc, or vitamin B12, hormonal imbalances like low testosterone or thyroid function, or various gut health markers. Once identified, Dr. Borenstein might suggest supplementation, stress reduction techniques to manage the effects of chronic illness, or lifestyle modifications like improving sleep hygiene and exercise. While an antidepressant may sometimes still be necessary long-term, addressing the underlying sources of illness can improve patients' quality of life across the board and prevent other illnesses down the road. In many cases, patients find meaningful, and sometimes life-saving, relief, as Dr. David Borenstein knows firsthand. Manhattan Integrative Medicine of South Florida reviews speak for themselves. Patients speak of how integrative medicine put them on the path to SIBO recovery, of having their comfort restored after finding treatment for Hashimoto's disease, or simply of being finally heard and treated with respect. Functional medicine is the future of healthcare, says Dr. Borenstein. The current model of 15 minutes with the doctor before being passed along is simply not working for many patients with chronic disease. Manhattan Integrative Medicine of South Florida is proud to be a pioneer in integrative and functional medicine, and I'm proud to be one of the few MDs in South Florida to provide this care.